Okay. All right, so we can move on from there into active, passive and resisted testing. One of the problems or peculiarities of this part of the spine is its length. And it's easy to miss an area, particularly if that area is painful and they'll inhibit movement. So when we go through these tests, we really need to make sure that we're taking the range all the way through the whole of the spine. And you do that by guiding the patient's movements. Okay, rotation is relatively simple. Let's spin you around this way. So turn your body to the right for me, much the way we do it in fact, exactly the same way we did it in the lumbar spine. Overpress for the end feel, don't let me move you anymore. And there is the resisted contraction of the left rotators. Go to the left for me. Overpress, don't let me push you anymore, and relax. Okay. For extension, I'll swing around this way so you can see what I'm doing with my hand. I'll try and stay out of your way at the back. I'm going to guide the extension with these fingers and just ask her to extend over the fingers as I guide her chest back with this hand. So just bend back over my fingers and we just work our way down there until I'm at the thoracolumbar region, and then I'll just apply some overpressure through the chest there. Don't let me move you, and relax. And there's a resisted test. For flexion, much the same thing. If I'm not careful and I ask her simply to bend forwards, she'll do most of that from the hips. To make sure that you're going through the thoracic spine, then guide her through it as well. So bend forward and have a slump that away. And then in this position, we can overpress and don't let me move you, and relax. Good. For side flexion, same thing. If I just say bend to the left, she's likely to do that. So as she bends to the left, I'll also slump her to the right. I'll get a nice solid end feel, capture here as I get this, and don't let me move you, and relax. And bend this way, and don't let me move you, and relax. Okay, now, we're looking for exactly the same thing as in the lumbar spine. We're looking for the range of movement, the reproduction of symptoms, the end feel, and the strength of the contraction. And basically what we do is correlate all of those findings and come up with some form, hopefully, of a provisional differential diagnosis. And then from here, we'll go into the neurological tests.